Good afternoon. My name is Chiquita Jones. I am an ambassador for the HBCU C.A.R.E.S initiative. The initiative is out of Clark Atlanta University, and its purpose is to educate undergraduates in professions in the mental health field that are available and encourage them to seek these professions. Today I have with me Dr. Mauro Garcia Altieri, staff psychiatrist, and he is going to answer some questions for us. Good afternoon, Dr. Garcia.
Good afternoon, Ms. Jones. Thank you for having me.
All right, so we can get right on into it and ask a few questions of you. Thank you for giving us your time today. The first question I have is, why did you choose your particular career path?
So very apparent, simple question that has a complicated answer. I've always been an individual that has a lot of different interests and indecisive by nature. So my journey and choices leading to the career that I trained and got educated and currently I'm a psychiatrist. So throughout my high school into college, etc., I had many different interests. I explored through different programs, different potential areas. And after careful deliberation, I ended up choosing to go into medicine and then eventually into psychiatry, because I thought that it had the balance between my intellectual curiosity into scientific matters, particularly biology, pathophysiology, etc. Also with my humanistic and interpersonal needs and skills. So I've always been very interested in human nature, behavior. It's extremely essential for me to interact with many other with individuals and be able to help them. So I felt that this career path was a perfect match, or as close to perfect match as possible in terms of getting those interests and personal characteristics and skills in a way that implements it towards a common goal.
Okay, I see that. For as long as I've worked with you, it's very clear now that you answered that question. You are perfect for the job that you do, and we appreciate you on our team. We really do.
Thank you for your words, Ms. Jones.
You're welcome. Next question. What are some challenges that you have faced as a working professional?
So there have been plenty of challenges at different stages throughout my training, right? Mm-hmm. Throughout college, med school, there are different, more of an academic, time management, stress, etc. And obviously later into the training, once you go into more clinical and practice, there are other competing different interests. Being sleep deprived, managing very challenges related to, of course, test taking, performance. As an individual that also asks a lot of myself, right? Mm-hmm. Not necessarily because I had external pressure, but because I put it on myself. So I had to learn how to navigate that. I'm not saying that I got into a perfect place, but it's definitely something that you continue to strive and you continue to re-examine. For me, one of several things that were important in terms of achieving a stride was, number one, being very clear about what my goal was, right? Once you're very clear about what you want to achieve, it's easier to keep the motivation throughout those different competing waves, right? Of stress or life circumstances, etc. So that you can keep that north and try to move past those different challenges. From a personal and also a cultural characteristic, it's the reliance on my support, right? So I'm very close to my family. I fortunately have a very supportive family. also a very nurturing and close group of friends. So now when these challenges were going on, again, personal, career related, etc., relying on them, communicating, expressing myself was extremely essential in terms of navigating through those significant hurdles.
Can you please tell us what you do in the behavioral health field?
So I am a psychiatrist, as I mentioned. Specifically, I am a consultation liaison psychiatrist, which is a subspecialty within the field of psychiatry. And what that means, it used to be called psychosomatic medicine. And what this field does, and what we do, is we take care of the mental health and psychiatric aspects of individuals that have significant medical or surgical conditions, so that we train in different models of care and we get a different set of skills in terms of how to manage these specific neuropsychiatric aspects of their diseases. So me specifically, I work clinically. Part of my time is dedicated to clinical care, and I specifically work with solid organ transplant patients. So what we do is that we work in an interdisciplinary team. We make evaluations of individuals that have end-stage organ disease, which means that their organs are no longer functioning as they should, and they might require a solid organ transplant. And we get involved to examine these psychosocial aspects that might affect their ability to get through this very complicated process and surgery. So we make determinations of whether they are able to receive these organs throughout the team. And then after they're listed, we many times then do reassessments, reevaluate their needs as things progress. We might do interventions as well, treatment interventions, pre, peri, or post-transplant. Yes. And obviously, I always say transplant is a team sport. And I actually tell that to my patients. Yes. Because it is very much, we all take different pieces of this very complicated scenario, as is obviously being so significantly ill and having all of these challenges. My other piece of clinical care, I work as an outpatient consultant to some of I work in the Michael E. VA Medical Center, which is a super tertiary quaternary hospital with lots of specialty services. So I specifically collaborate with the services of oncology, patients that have cancer, palliative care, so individuals that have probably end stage into latter stages of their lifespan. I also deal with individuals that have come from the infectious disease clinic, so specifically patients with HIV, GI, gastrointestinal disorders, and cardiovascular disorders. So in a way that, again, sometimes their disease process causes neuropsychiatric symptoms, or the medications themselves cause neuropsychiatric aspects, yes, or vice versa. They have some psychiatric disorders that affect the course of their medical illness. Mm-hmm. So we try to put those pieces together and help them in a holistic way. My other significant role is that I'm an educator. So I am faculty at the Baylor College of Medicine here at Houston, Texas, from at the Menninger Department of Psychiatry and Behavioral Sciences. So specifically, my main role is that I am currently the Consultation Liaison Psychiatry Fellowship Director. Mm-hmm. So the fellowship program in psychiatry, this specific one, is a one-year program that happens after 4 years of their general psychiatry residency program. So I manage everything related to the clinical care, clinical curriculum, educational curriculum, academic and research related endeavors. I also have other responsibilities related to the residency program, etc. I'm not going to go into all of those details. And one of the other things that I do wanted to point out is that as a consult liaison psychiatrist, I think that one of our main roles many times is education, but not just within our lane, within our disciplines, mm-hmm, but also our other disciplines. As Ms. Jones very much knows, we work in interdisciplinary teams. Yep. So we collaborate between nursing, pharmacists, nutrition, social worker, mental health clinicians, medical specialists, surgical specialties, PAs, etc. And so we many a times collaborate as a graduate level, already at attending level, but many times we got other levels of trainees, so students, residents, etc. So we collaborate and we educate each other formally and informally as well. So that's one of the things that it's also extremely interesting of what we do, and it's extremely exciting, challenging, and very rewarding.
Talk to us about the educational process for you from start till now. What does that look like?
So my career path has been a traditional one. And what that means is I basically did all of my training back to back without significant detours. So I graduated high school, went to the university, did a bachelor's in science. 4 years, it took, I did it in 4 years. I went into medical school immediately after that, and that is a 4-year process. Sort of first half of it is kind of like the basic sciences and pathological sciences. Then you go into the clinical care related rotations, etc. I chose psychiatry. I was fortunate enough to go into a psychiatry residency program. That was another 4 years. And in that process, you're mainly doing clinical related duties, and you learn by formal teaching and also obviously by doing, right? And then I had 1 extra year of I did it when it was still called psychosomatic medicine, now consultation psychiatry. So that was an extra year. So that was 13 years post high school. Having said that, I've worked and had the pleasure of being at different stages in my career to deal with other peers and other professionals that have had a different course. So they have had alternate paths, and that includes doing other further training, doing masters, doing a doctorate, doing another bachelor's, whatever that might be. And then they might then go into the field of medicine and or psychiatry specifically. But I mean, I've had trainees that have been journalists, that have been professional comedians. I mean, everywhere, artists, musicians, other science-related fields, even again, nurses that turn into medicine. I mean, so what I mean by that is that each person has its own journey, and there are many ways in which you can get to the point that you want to be.
Yes.
And that you need to be.
I appreciate that. I always say that in all the specialties that I've worked, mental health is the one thing that spans every specialty. It's the one thing that spans the entire spectrum. In all parts of treating patients, there's a mental health aspect. Even if it's just helping them to cope, there is a mental health aspect attached to every specialty that I've been involved in nursing. Yeah. But I thank you so much for your time. I appreciate you investing in my education and the education of our undergrads. Anything else you want to share with us?
Thank you. Thank you for thinking of me and inviting me. It's my pleasure to help in whichever way I can. So thank you so much for your time.